Good morning. My name's Phil Hadley. I'm International Director for AHDB. On behalf of AHDB, I'd like to welcome you to this morning's webinar that's going to address market access and changes or impacts of COVID-19. There's not many parts of our everyday lives, and particularly our professional lives, that haven't been affected by COVID and the changes that are having to be implemented as a result. So today's webinar is going to discuss some of those challenges and discuss some of those changes, and we have a panel of speakers that will cover various elements related to COVID. Waffa Dobson, Market Access Manager with AHDB, will kick off with a global overview. Then we'll hear from Heather Brown from the Animal and Plant Health Agency, and then Anna Joy Coulter and Ramona Branza from DEFRA. And then we'll talk about remote auditing with Christian Nistel from the Food Standards Agency. And there'll be time for questions and answers, with the webinar scheduled to end around 12:15. I'll just walk through some of the rules of engagement for this morning's session so that we're all clear, and particularly flag up the question options. So other than the speakers, everybody, including myself, will be muted through the webinar. Apart from various slots. We're finishing around 12:15. The question period at the end, so please start to think about any questions you might like the speakers to address, and we'll come back to those. If you fill them in the question box in your toolbar, I'll be able to see those and I'll direct them to the speaker. So if you have a specific question for a specific speaker, please go ahead and fill in the question. The webinar will be recorded and will be available on the AHDB website at a later date. If you want to revisit the content, or indeed share that with any of your colleagues that it's relevant for. The DEFRA presentation won't be available afterwards, so I encourage you to pay particular attention during the slot with AJ and Ramona. And right at the end of the webinar, just as I close, there'll be a poll which will ask you to rate how useful you found the webinar. And that's important for us to make sure that we're targeting these sessions in the areas of interest, particularly to the audience. So please do take a moment to finish, to complete the poll on the finish of the session. This session's particularly aimed at our meat processing stakeholders, and you'll see that the presentations relate specifically to meat plant operations and COVID controls and so on. So that's the target of the discussions. And again, please do fill in your questions as we go along. So that's enough from me. And I'd like to pass to our first speaker, Waffa Dobson. She's our Market Access Manager and very pivotal in the market access brief for AHDB, working closely with stakeholders and government to try and secure market access in third country markets. So with that, I'll hand over to Waffa. Thank you.
Thank you, Phil. As Phil mentioned, the purpose of my presentation is to give a short overview of some market access measures and adjustments adopted during the pandemic. Next slide, please. So during the presentation, I will provide background information on market access measures, an overview of some market access measures adopted by different countries, and market access adjustment in response to the pandemic. Next slide, please. As a starting point, I thought it would be useful to provide some background information on the international trade framework in which the COVID-19 measures were adopted. So the WTO deals with the rule of trade between the nations and the smooth flow of trade. In response to the pandemic, WTO members have adopted a number of market access measures and notified the WTO accordingly. As you can see on the slides, this measure was submitted under the Sanitary and Phytosanitary Agreement, known as SPS, and the Technical Barrier to Trade, known as TBT. Basically, in a nutshell, this agreement set the basis on which standards and technical regulations are adopted. So a measure is adopted to protect public health, animal health, plant health, the environment, and to ensure product safety. Next slide, please. Next slide, please. Oops, I think one more back, please. Sorry about that. That's the fun of being live. Given the urgency, most of the notifications submitted were made under the emergency notification provision of the SPS and TBT agreement. Basically, under this provision, WTO members can adopt measures without providing the usual 60-day comment period. So this means that the measure can be adopted at a very short notice. Having said that, however, the measures still need to comply with the SPS and TBT agreement. So basically, this involves avoiding discriminatory or unnecessary barrier to trade, the need for the measure to be science-based, and to be in line with international standards. As you can see on the slide, on the 11th of November, a total of already 271 notifications has been submitted to the WTO. And this really shows the scale and the impact of COVID. Next slide, please. This map really reinforced the point I made earlier regarding the exceptional volume of notification submitted to the WTO. By looking at the map, we can really have a sense of the impact of COVID globally. Also, looking at the map, the darker is the color, the higher is the level of notification submitted by a country. So we can clearly see that most of the notification, or quite a high level of notification, were coming from Europe and from the Americas. Next one, please. As you can see on this slide, a large proportion of market access measures adopted relate to PPE, food, and live animals. As I mentioned earlier, TBT measures mostly relate to technical standards. And this is the reason when we look at the graph, most of the PPE product is only covered by TBT measures. On the other hand, SPS measures are mostly adopted on the ground to protect animal health and public health. And this is the reason why, again, when looking at the graph, the live animal category is only covered by SPS measures. Next slide, please. Right. Now we're going to turn to the second part of the presentation, which covers global market access measures. Next slide, please. So in this slide, if I were to ask you the type of measure I am about to talk about, what will you say, knowing that we can see that it has to do with on-hold and standards? Next one, please. Well, it is temporary suspensions of domestic standards. Next one, please. The overall objective of this measure is to ensure food availability. And this is achieved by managing disruption in the fulfillment of imported raw material. Basically, it means that the imported country allows a deviation from its normal export requirement by temporarily relaxing technical regulation while maintaining public health. For instance, this is the case with Indonesia, who from April until December this year has temporarily suspending the fortification and quality requirement for food staples. And as mentioned earlier, this is to ensure product availability so that the domestic demand is met. Another example, as shown on the slide, is Switzerland, who in April relaxed temporarily its food labeling requirement. And this was in response to a shortage in food ingredients and packaging material as a result of the pandemic. Next one, please. Well, I think this slide is quite self-explanatory on the type of measure I am about to talk about. Yes, COVID-19 testing. Next one, please. Some countries introduced a new COVID-19 testing requirement, and this measure aimed to manage the risk of importing COVID into the country. So, for instance, as shown on the slide, back in April, Indonesia introduced a new requirement for the importation of live animals. Indeed, they had to be accompanied with a certificate stating that the animal is free from COVID. Next one, please. Right, again here, just to make sure you still stay with me, if I were to ask you the type of market access measure I am about to talk about, knowing that we can see it's got to do with import, tax, and cuts, what would you say? Next one, please. It is temporary tariff import suspension. Next one, please. The aim of this measure is to maintain the supply of affordable goods so that the domestic demand is met. And this is achieved by temporarily relaxing import duty. As shown on the slides, back in April, sorry about that. As I said, the joy of being live. Back in April, Morocco suspended customs duties on certain dry commodities. And at the time, the decision aimed to provide regular and affordable supply of goods. Next one, please. Right, I think this is quite clear what it is about. Next one, please. Temporary import restriction. Next one, please. In the early stage of the pandemic, some countries introduced a temporary import restriction on certain species of live animal and animal products. To start with, this restriction targeting import from China, but then were expanded to other countries such as Republic of Korea. The range of commodity concerned imported from exotic animal, insects, and live fishes. Next one, please. Well, I think my slide is quite self-explanatory again. This measure relates to export ban. Next one, please. Next one. One more back, please. Thank you. This part of the presentation, now I'm going to move on, look at the selection of market access arrangements that were adopted as a response to COVID, mainly to ensure that the trade flow is being maintained. Next one, please. So I'm going to talk about electronic processes. Next one, please. One of the issues with the pandemic was, and quite frankly still is, staff availability to process the necessary trade document. To maintain market access and trade flow, we saw a streamlining of processes and an increase in digitalization. Several countries temporarily eased the certification requirement and moved towards electronic processes. Next one, please. As an example, this slide provides an overview of the issuance of proof of preferential origin before the pandemic. So if we were to look at the export step, the exporter liaises with his declarant who submit the rule of origin paperwork to local customs office for verification and stamping. The paperwork was then returned to the exporter via the declarant, and the signed verified paper accompanied the consignment. So now, looking at the import steps, as I said, the paperwork traveled with the consignment. So once at the border, the paperwork is verified and returned to the importer. However, as a result of the pandemic, two main issues emerge. The impossibility for declarants to come to the customs office and the closure of the customs offices. Next one, please. One back. Thank you. Thank you. As a market access adjustment, the EU customs authorities allowed a number of alternative measures for the certification of proof of origin. So these including issuance of confirmation letters digitally signed to prove the authenticity of unstamped certificate and exchange of scanned certificate via email between the economic operator and the customs office. I have to say that the topic of electronic processes will be further discussed by APHA when presenting adjustment made for the export health certificate. Next one, please. The next market access adjustment relates to the use of remote audit. Next one, please. In response to COVID-19 impact, such as travel restriction and staff availability, some countries have adopted remote audit as an inspection tool. So as we can see, this is the case of the UAE, who carried out video inspection for the renewal of plant listing. The use of remote audit by third country and the preparatory work involved by the hosting country will be covered by DEFRA, while the use of remote audit as a domestic official tool will be discussed by the Food Standard Agency. Thank you.
Okay, thank you, Wafaa, for a run through of what the current situation is and how it's impacted on third country trade and third country discussions. Helpful to set the scene on for this webinar. I'm going to hand over now to Heather Brown from AFA to talk about export health certification, EHC, and easements. So if I hand to you, Heather, for your presentation. And can I just again take the opportunity to remind people, if they have questions, then please fill in accordingly on the toolbar on your webinar screen. Thanks.
Thank you, Phil. Yeah, I'm Heather Brown. I work in the Centre for International Trade in Carlisle as one of the delivery managers, in conjunction with Ian Hutchinson, who's representing DEFRA today. I'm going to talk about the easements we had to put in place when the COVID-19 pandemic hit us in March 2020. So next slide, please. Thank you. So when we were hit with the pandemic back in March, it did bring many challenges to the delivery of export certification for the export of live animals and animal products. We had to think about how we were going to maintain trade and continue to deliver export health certification to the importing countries. Okay, so the consideration was, how could we deliver export health certificates currently produced on crown gold paper and posted out to the certifier with the logistics that we also faced and the closure of government offices. The proposal was an initiative to produce all export health certificates on plain white paper, which could then be transmitted by email. Okay, this would help all APHA staff and DERA staff who worked in conjunction with DEFRA, and it did help in avoiding delays in transmitting export health certificates to the certifiers. Because these measures were needed because we had to take account of the reduced availability potentially of officials and the temporary closure of government offices. And as we are well aware, the disruption that was caused with logistical services, both couriers and postal services. Next slide, please. So how we approached this was we did look at those countries where we produced the majority of export health certificates currently to third countries on white paper, on crown gold paper, sorry. And as you can see there on the table is 25% of these were China consignments, 8% were USA, and so on. So initially, with these data, DEFRA contacted the competent authorities within each of these countries to request easement and for us to produce export health certificates on white paper going forward for the foreseeable future during COVID pandemic. In total, 11 countries agreed for us to actually produce certificates on white paper, which is a real great achievement. Next slide, please. We have now found that 50% of export health certificates to third countries are now produced on white paper. A majority of these are also transferred electronically. The two countries, China, APHA staff are registered on their eCert system, which means we upload the certified copy on receipt from the certifier. For Australia, the actual importer themselves log on to their system called Cargo Lodgement System, and they register that that consignment is due to arrive. For 5 other countries, APHA email copies of the export health certificates to those importing authorities, and for 4 countries, no further intervention is required from APHA. It's all based on that copy that is received once it has been certified. So this has been an impact on the offices being closed and has been able to continue to delay export health certificates. Okay, next slide, please. So what we did find during the pandemic was that officials need to attend export health certificate attend offices to produce export health certificates on crown gold paper. This is specially adapted paper that has a watermark through, and it is held and stored securely. A lot of the export health certificates are produced on A3 printers because they are actually 3 pages or more, and there are also many different documents that have to be printed alongside the certification. This meant that staff had to attend offices to be able to print these certificates, and with the easement of Crown Gold, it meant people could work at home without having to attend the offices, and they could actually email them across to the certifier instead. This also impacted our restrictions by the post and courier services, that we did not need to arrange that as everything went much more smoothly. We have adopted, as mentioned earlier, where we do upload certificates to the Chinese eCert system, and this has proved beneficial to actually not sending them by post. Next slide, please. So what we have found is that this has been well received across the 3rd countries that have agreed to it, and we have now got an extension up until the end of February 2021. China are very keen for us to continue beyond COVID and continue to use their eCert system to actually upload. I mean, they do have slow internet access requirements sometimes, but we've been able to work around this with our colleagues in APHA, DEFRA and DERA to actually adopt and deliver through this method. We are looking going forward in a project between DEFRA, DERA and APHA to phase out crown gold paper for all export health certificates in 3rd countries, and are looking at introducing alternative security features. That's my presentation for today.
To continue the theme of remote and semi-remote audits, over to you, Christian. Thank you.
Hi all. My name is Christian Nisto, and I'm one of the export veterinary auditors from Food Standards Agency. My primary role at the moment is to ensure that the exporting premises are compliant with domestic and specific 3rd country standards. What I'll be trying today is just to highlight the way FSA and especially the 3rd country department adapted to the new pandemic situation. Can I have the next slide, please? We'll be covering today a bit of background, the definition of a remote audit and a semi-remote audit, as well as the IT system, and most importantly, data security issues, risk feedback, some tips, and we'll try to conclude. Can I have the next slide, please? This novel coronavirus is presenting a number of challenges in the way which FSA undertakes its regulatory work, the audit. So today I will be covering both parts of the audit, the domestic one and the third country ones, and should a bit of difference between. Can I have the next slide, please? As a definition, on-site audit, it is an audit which being done prior to this pandemic situation. It involves an on-site visit and the document and records are checked at the premises. A remote audit, it is an audit carried out without visiting the site, but supported by the resident of the on-site and the evidence provided electronically by the FBO and the OVs on the third country, which we'll tackle in a minute. And finally, a semi-remote audit. It is an FSA audit in which part of the audit is carried out on site for targeted physical checks, and part is completed remotely, where the documentation records meeting are done off-site. As most third country audits are currently carried out semi-remotely. Can I have the next slide, please? It's worth mentioning that the auditors will decide on a case-by-case basis if the audit will be carried out remotely, semi-remotely, or on-site visit. That's the difference between the domestic audits. For the third country ones, by definition, they are all semi-remotely. Remote audits, alternative to the site visit, as explained in the definition, the use of electronic means to remotely obtain audit evidence to objectively evaluate compliance within the audit criteria. In the domestic audit, poor performing establishments will not benefit from this remote audit. This system seeks to minimize the work health and safety issue, as well as travel challenges and risks presented by COVID-19 to both FSA and FBO staff. Especially for the FBO, they will limit the exposure to those outside of their standard workforce. And the second point is this remote audits to maintain an audit system that provides the necessary assurance to all stakeholders, and that will be some barriers that you will see in a minute. Can I have the next slide, please? The definition of a semi-remote audit. It is an audit at the required standard, including a site inspection, but minimizing the time in the establishment. During these visits, all the records and documentation is done as a desktop exercise remotely. This approach provides a reality check on the implementation of the food safety management system and export requirements, verify product conformity with product and reference sample in hand during production, better in the preparation of the site visit with targeted audit trails, and that is usually carried out during the preparation. And I think the most important is to minimize the time in the plant, which usually before the pandemic situation, there were 2 days of audits. They just reduced to a few hours inspection time. The FBO must provide measures as per COVID government guidance. And as I said, meetings and documentary checks are held remotely, obviously when it's possible. Can I have the next slide, please? There will be a big difference between exporting premises, which are larger premises. They have the resources, they have the technical team, they have the facilities to accommodate a remote and a semi-remote audit. On a domestic, on a UK base, there will be small to medium-sized premises, which will not have the technology that the big premises they have. I will explain a bit how we do arrange and do a preparation of the remote and semi-remote audits. Prepare the audit, considering previous outcomes and any available data. As I said, the poor performing premises will not benefit from a full remote audit. The FBO will be made aware at this stage if the audit cannot be carried out remotely satisfactorily. It will imply the need of an on-site audit or a semi-remote audit. Then the auditor will contact the FBO to agree the scope and the methodology used. The auditor agrees with the FBO and the competent authority representatives. The documents and the records which be required, the time scale as well, and the potential use of pictures and videos, which might be useful for assessing certain issues. Can I have the next slide, please? Then we go on the review the documentation obtained, and if necessary, ask for additional information, which we'll find out there will be quite a lot of emails between the FBO and the FSA. And then considering the current climate with potentially experienced staff shielding or quarantine, especially for the quality team and technical team, staff practices or supervision might be affected. Therefore, if the information provided during a remote audit is insufficient or unreliable, the auditor might decide to perform a site visit or a semi-remote audit. And we've got during the closing meeting, we will be discussing the outcome frequency, we'll discuss the non-compliances, an area for improvement, as well as give the opportunity for the FBO and OVs to clarify any issue, ask any question or add comments. And finally, the report is sent. Can I have the next slide, please? This is some of the system which we used to receive documents and communicate with the auditee. We've got Teams, we've got Skype, Zoom, emails, and for the transfer or larger data, the FBO are quite using WeTransfer, which is a good tool if you had to send quite a big document, and usually the email will have a bound of a few megabytes. Can I have the next slide, please? And this is something which we find out that some of the FBOs are reluctant to say their internal procedure, such as SOP or HACCP plans, due to security and copyright concerns. FSA has a government department that holds governmental data, adheres to the government security policy framework. And as you see, there are links for anyone who wants to investigate further and see exactly what is all that about. After the audit, the auditor deletes all documents, records, pictures, and video received. The evidence gathered for enforcement purposes will be handled as per instruction in the FSA manual official control. Then to conclude, it is the policy of the agency to ensure that information will be protected against unauthorized access. Confidentiality of information will be assured, integrity of information will be maintained, regulatory and legislative requirements will be met, and business continuity plans will be produced, maintained, and tested. Can I have the next slide, please? This is something which I will tackle the issue and risk identify during these third country audits, but the normal FBO audit as well. As I said, there are two components. Unsure if this can be used outside the emergency situation. Uncertainty if remote audit will be accepted by a third country, and I think AJ tackled that. So it could be time consuming for the FBO, OVs, and auditors. At the moment, FSA is collecting feedback from all the players, from the FBOs, OVs, and VAs to acknowledge all this whole process of remote. The data collection is finishing at the end of December. So until then, we will collect all this information to see exactly how can we improve this and make it formalized if would be a second or would be another pandemic situation. Difficulties to gain clarification. Sometimes it's difficult to understand the FBO documentation if you're not familiar with them and they cannot explain it immediately. As an example, you spend time writing what the issue is and they will provide answer which still cannot fully clarify the query. It is faster on a face-to-face meeting. Can I have the next slide, please? Limitation for assessing performance with a video tour. As AJ tackled earlier, small details, attention to details, practices, other areas. Documentation is not always provided simultaneously. I would say the risk of FBO performing a quality check and amend the records before sending them, as we found out, training records dated after the request could be a potential risk, or correctly completed document when we know that there has been a constant issue in that specific premise. FBO not being able to use the existing technology. We will find out that FBO, some of them, they don't own a scanner, unable to scan documents even when owning a scanner, or we seen FBO using the post office to send records, which is time consuming. The small, medium-sized premises could not have the technology to accommodate a live streaming exercise or share CCTV footages, as explained. Can I have the next slide, please? A few tips and advices from us. Please choose a meeting tool that can accommodate the minimum number of individuals that need to participate in the audit. As we know, Zoom will only allow you, the normal version will allow you only a few minutes and a specific number of people. Sometimes network connections are not very reliable, or the auditee can have difficulties with accessing the database in order to show evidence. In addition, due to the network issues, interviews and meetings can be interrupted, taking some time to reconnect and solve all the network problems. Please check your internet connection before the meeting and perform several tests. Prior to start any video conferences, please lay ground rule for housekeeping, as for example, mute your microphone if you're not speaking, and ensure all are in the free space of outside noise and disruption. If connection is not adequate, consider turn off the camera, because we found that this will improve the communication. For your initial audit, opening meeting and closing meeting as well, it's good to ensure that all relevant members are present. Put available technical operatives which will understand the food safety risks. Have all documents in an e-folder ready to share if needed. Can I have the next slide, please? We found a very good tool is a self-assessment prior to the remote audit. This self-assessment could potentially identify issues before the audit. I know some of the FBOs are using as an internal audit, which shows a bit of proactiveness if they could complete this self-assessment before that. If they will identify any non-conformities, they have to be closed out, obviously, and then evidence provided to the auditor. Training and experience. Lack of training or experience of the auditor and auditee, which are conducting and receiving remote audit, can lead to inability to collect sufficient audit evidence and thus assess it objectively. Therefore, it is crucial for the virtual team to have the necessary knowledge to correctly conduct audits using the existing technology. Can I have the next slide, please? I'll try to conclude. Remote audits. Are the future auditing? I don't know. Good. But the part of remote audit are more likely to stay. Their advantages are unquestionable over the traditional methods regarding cost and time. Using a hybrid approach, semi-remote, that includes a remote program evaluation, followed by the on-site audit of the implementation, allows for both an in-depth review of the written procedure, as well as an in-depth inspection of the facility, employee practices, and the site environment. Improvements of live streaming of premises will benefit for the auditing objectives. And as the last sentence, I will say that FSA is having regular meetings with the meat industry or with the industry itself to discuss the audit system during this pandemic period and ways of working together. And that's it. Thank you. Thank you for me.
Thank you, Christian. A lot of detail in those last two presentations about a remote audit and what's required. And I must say that there's a lot of support available from AHDB, UK Export Certification Partnership, and indeed government through DEFRA and DERA to support businesses on that remote audit position. If I could ask the speakers to turn on the necessary now, we'll go to the question session. We have got some questions coming in, so if you do have questions, please type them in the bar and I'll try and address them. And if we can't address them directly during the session, then we'll respond separate. A couple of questions here for Heather, if Heather's still with us, relating to the eCert system. I can't see you, Heather, but I hope you can hear me. Ah, there you are. Yep. Perfect.
I'm here.
Thank you very much. So a couple of questions, if I can direct them to you. The one is around experience from an industry user in terms of the efficiency of using the eCert type system, and questions around extending it, what the scope of it might look like in a few months' time effectively. Could you say a few words on what the ambition is to transition to that type of platform? And it kind of wraps up into a second one, which says, is there a target date to have all export health certificates available online? Perhaps you could try and, they're similar questions. I wonder if you could take those in one go.
Yeah, sure. I mean, we work very closely with our colleagues in market access. So we're the delivery agent, and it's market access that do the negotiations with those important authorities. So we'll need to bring Ian in to obviously some of that discussion with regard to the eCert system. It's a system that China have currently in place. We have adopted using that system to upload export health certification after it has been certified, and that's how the notification currently is received by the importing authorities in China. China are very keen to continue with the usage of the eCert system going forward, and currently we have negotiated that will continue for the foreseeable. But Ian, I don't know if I can bring you in if there's been any further discussions beyond February.
No, it's my connection. Just when you were going to talk about China and their ambition to take it forward, I wonder if you could finish that sentence, and then Ian was going to add, I think. Apologies.
Yeah, no, fine, no problem. China are very keen for us to continue to use the eCert system going forward. Further negotiations need to be had as to how we fit that best into certification, and I think that will be looked at when we look at our future next steps with regard to fading out crown gold paper, and that's where I was going to just pass on to Ian.
Yeah, so not much more to add really. I mean, the eCert system is a particular only concerns China, as that they are happy for us to continue using it. It's not particularly from their point of view a COVID-19 easement. It's something they were planning to introduce anyway, and yeah, other countries exporting to China also use the system. The only difficulty from our point of view has been the sort of connectivity to the system has been a bit of a problem, which has improved over recent months, and hopefully that will continue to be that way.
Yeah, so as with all things, you know, teething problems with the technology, but hopefully that will only get better over time. I
Yes,
think the
exactly.
Go on, Heather.
Sorry, I don't mean to overspeak people, so I do apologise there. I think when we go further forward with our negotiations with third countries, I think the preference would be that we adopt the same system for all countries, because as you're aware, the volume of third countries that we have export health certificates for, we really don't want to adopt different protocols for each and every country, because that would be a minefield for, you know, us to manage and implement going forward. So although currently as I said, we've got 11 countries where we do actually do white paper certification for COVID easements, we have adopted different processes dependent on what the importing authorities agreed with us. So going forward, I think we do need to move away from that, and we would have to look for a much more rounded one-fit-all approach. Otherwise, we would find it very difficult from a delivery aspect to accommodate.
Yeah, okay. I think that, I mean, that's understandable. I'm sure the industry stakeholders that are on the call would welcome that streamlining of the service in terms of being access to electronic certification, but also a standard platform so that there aren't multiple processes to avoid the risk of error or delay or so on and so forth. So I think the stakeholders would find that a positive, encouraging note. Also recognising the fact the demand for export health certificates is going to increase pretty markedly, or has the potential to increase pretty markedly in the coming months, and as we get more access. I guess it's really positive that China are welcoming that service, given the importance of China to our port market, but also our recently granted beef access as we start to send commercial shipments, not yet in place of course, but as we start to send commercial shipments, that will also be you know, a welcome system to use that hopefully will make things just easier and less subject to error and so on. That's great, thank you. A question for Wafaa, just to go back to the beginning, the first presentation, you talked about countries making market access or adding market access constraints or taking a market access measure. How do businesses or governments find out when a country's taken an additional market access measure or change their requirements?
Sorry about that. Yes, the country can find out when another WTO member has adopted a new measures. The WTO basically has a SPS and TBT notification alert system that is known as EPING. And the EPING systems allows whoever is registered to receive daily or weekly updates on new notification. And all you have to do basically is go on the WTO website, you can search EPING, and then you will find it, and then you'll be able to register, and it's a free service.
Okay. Okay, so there's a mechanism there to be able to track those changes pretty instantaneously. Yes. From what you've explained.
On a daily basis, and this is what we have been. Well, this is what I have been doing during the COVID situation. I am registered to the EPING system, and I've been receiving notification as and when they come in, and been monitoring them.
Okay, great, thank you. Heather, I've got another question in relation to your comments about e-certs, and this one is specifically about what's the position for exports to the EU from the UK, and is it likely e-certs will be in place for that going forward? I've also got a commendation that industry welcomes the electronic system for the reasons we discussed. So there's a thumbs up in one perspective, but this question specifically relates to the position for using e-certs with the EU. Ian, you look poised to answer that.
Yeah, I think it might be one for me, really. Yes, well, the e-certs is a Chinese system. It's a Chinese government system, so it is only available to use for exports to China. For exports to the EU, well, I believe traces would still be used for exports to the EU, as other third countries do currently.
Okay, so no significant change there at this point in time.
No, certainly e-certs couldn't be used for any country but China because it is a Chinese system.
Perhaps we're using, perhaps the language is not quite right then. Is the long-term perspective then to move to an electronic-based certification for exports to the EU, or do you think it will still remain a paper-based system for the foreseeable future?
Do you want me to answer that, Ian?
Yes, okay. I think that's one for you.
Okay. I mean, all EU certificates are produced on white paper, which is a bonus. So they are all emailed through to the certifier at the moment, or actually through the ECHO directly into their certifier portal. At the moment, there isn't any platform to integrate that with any EU countries. It's a standalone ecosystem. We're still in negotiation with what use we'll have of traces going forward, and that still hasn't been clarified. We are preparing at the moment that traces will not be an option for export certification. I think it might still be there, as we know, in some form for importation, but for exports we are working on the basis that it will purely be white paper certification direct to the certifier, but then currently there will still be that hard copy that will need to be presented to those importing authorities. We certainly would like to move away from that long term, but for the foreseeable, until we exactly know what happens from the 1st of January with traces, I can't advise further.
Okay, so I guess that's really a picture of where you are right now with the information that we've got, but that's a moving picture, and there'll be updates, but arguably the longer term view is to move to a more of an electronic system, but that is medium to long term as it stands at the moment.
It is, yeah.
And I've got all the questions seem to be coming on the certification, Heather, and I'm mindful of the time, so perhaps this will be the last one, and then you'll be off the hook. But it's a question about export certificates to EU countries, and will they be individually named countries, or will they just be a blanket EU type certificate?
There'll be a blanket EU. I think from memory, I think there's 128 EU certificates that have been prepared, which are now available to view on Form Finder, but they will be, we've done them in 26 different languages, depending which country they'll go to, but the actual model template for all countries within the EU is identical.
Yeah, and that people can find that on the gov.uk Form Finder portal. Yeah, okay, so that is readily available to people. If you haven't already, I'd encourage you to go and have a look on there and see what's available for use as reference material. So that's a great resource that's been in place.
Just to add on, Phil, all these certificates are available through ECHO, our new certification, Export Health Certification online service. So if you do need to apply for one of these export health certificates, you will need to register on the system, and your certifier also will need to be registered. So you apply directly online. Some of them are auto-dispatched, which is even better. So that means they don't need to be handled at all by a human being in APHA. They will just automatically go through to the certifier portal. And that's if no disease clearance checks need to be undertaken or any other additional checks. So that is quite straight through. So I do recommend people to have a look at that and to register if they haven't already.
And in terms of the registration, there's a link available, or what do the delegates Google to get to there?
There's a lot of support out there for registration, and when they do go through onto Form Finder, they will be advised how they do register on the system.
Okay, great, thanks very much. So there's the instructions in terms of going off and finding out what's on the Form Finder web pages and how you can register accordingly. So that's a useful pointer. Thanks for that. That's a pretty comprehensive answer. There are a couple of questions still outstanding, which I'm afraid we're not going to get to, unfortunately, but thank you for sending those in.